Hello, everybody. I just had carpal tunnel surgery about a month ago on my left hand, about 2 months ago on my right hand. Figure I'd share a little bit about what it was like. First of all, it sucked. If you're watching this video, you know about carpal tunnel. It hurts. You get numbness in your fingers, usually the inside of this, all of this, and then the side of this finger. Most people, it goes away like after you rest a little bit. For me, it was constant. It's still constant in my right hand. Slight, but still there. This one's almost 100% better or normal. Now, the surgery is actually not that bad. There's no in it. The one that I had, it was an open type surgery where they cut the skin, peel it apart. There's video of it on YouTube. Basically, they make sure they don't nick the nerve or anything. They cut the little ligament, make sure it makes more room in the carpal tunnel release. There you go. It's pretty cool what they do if you ever look into it. For me, I can't watch it. Like if it's on me, I can't watch it. Somebody else, I want to watch it, but that's just me. Anyway, back to the point. So, they cut my skin, spread it, cut the tendon, sutured it back up. There was three, I believe it was 3 or 4. I believe it was 3 stitches on each hand, obviously. They were done a month apart. They don't want to do them both at the same time because you'll be screwed up. You won't be able to do stuff, which that's another thing. When you get it, you'll think, oh, I feel good. I could do. Don't. Just make sure you keep it somewhere where you're not going to use it, basically. You want to rest it. But they put I believe it was 3 stitches, and they're the type of stitches that dissolve, I guess, for lack of a better term. And they put a waterproof bandage over it. Now, for the first 2 weeks or so, you can't get it wet. If you get it wet, the sutures release and you're screwed. You got to go back, get stitched up. But whatever. So no strenuous activity, all that. Grasping and pulling hurt. Like my doctor put me on no lifting of anything over 10 pounds, which even that's a stretch. 10 pounds is a lot when it's, if you're going through it, you know what I'm talking about. But afterwards, like I say, it's been a month since this hand was done, 2 months since this hand's been done. They still hurt. There's still numbness. You know what I mean? I mean, it's going away. It's getting better. Like, depending on your level of damage to your nerve, or whatever you want to call it, it'll come back. It'll regenerate, at least partially. He said it could take up to 6 months, 8 months, whatever. For me, it's been 2 months and still. Anywho, there's still soreness here and in the wrist. It still hurts. Sore. Not like a acute pain, but a soreness. It's not something that I think will keep you from doing anything. Once you get where the skin heals and it closes up, just be mindful of it. It's sore and it hurts. As long as you do your exercises, your little pray maneuver, do your exercises. That's another one. Those help. Get a little squeeze ball, a little light one that you can do. It helps a lot. It seems like it won't, but it does. Other than that, it's been pretty good. Like I say, it's taking a while for the feeling to come back, but it is coming back, which is awesome. If you're in the Houston area, Dr. Nola, that's the guy to go to. He's pretty good. The surgery, the prep is like 10 minutes, 15 minutes. They get everything together, put you on a little bed, get your hand all outstretched. Then they go through and iodine and clean it and everything. That reminds me. The anesthesia, or the numbing agent, whatever it is, it's a local anesthesia, and they inject it in different points around where they're going to do surgery. That's the most unpleasant part, honestly. It doesn't really hurt, but the feeling is not great. It's unpleasant. Like, no joke. It's not pleasant at all. Your hand will swell out because they're putting a lot of fluid in there. But once it sets, it takes about 15-20 minutes for it to set. You don't really feel anything. I mean, you could still feel, like if he's cutting or pulling, you can feel it, but the pain you don't feel. Once they get that and everything's done, iodine, whatever, the surgery takes, God, maybe 15, 20 minutes. I mean, it's pretty good what they could do. I mean, it's impressive. Recovery time, like I say, it's going to take you about 3 weeks for the skin to heal up, and then a good 4 to 6 weeks before you're really able to grasp and pull and stuff like that. But for a couple of months, I mean, he told me it was going to be about 2-3 months, soreness in your hand and your wrist, like the bottom of your palm and the wrist, definitely sore. You definitely don't want to hit anything. I mean, you'll know it if you do. But ugh, it hurts. Other than that, pretty good experience. If you have carpal tunnel, if you have a way to get it taken care of, get it taken care of. Seriously, get it done. It is not something to mess with. You don't realize how much you use your hands and how much you need your hands until you can't use your hands. And holy crap, you need it. Anyways, y'all have a good one. I'll see you tomorrow.